How common are TBIs? I'm Dr. Moshe Roth. I'm a neuro-optometrist. I practice in Old Bridge, New Jersey. According to the Centers for Disease Control, the CDC, an estimated 13.5 million individuals live with a disability that's caused by a traumatic brain injury in the US alone. Approximately half of all traumatic brain injuries are caused by a fall. How does a TBI affect vision? Well, there are more areas in the brain that process vision than any other system. The brain is essentially a vision machine. Most of the information we take in from the world around us is through our visual system. And in turn, our brain then directs our eyes to point where we want to look so we can take in more visual information. That's why a traumatic brain injury can often cause visual symptoms. A traumatic brain injury can disrupt the communication between the brain and the visual system and interfere with the processing or making sense of that visual information. That leads to blurred vision, reading difficulties, sensitivity to light, and double vision, among other symptoms. Visual problems tend to be overlooked during the initial treatment of brain injury, especially with a mild TBI such as a concussion or a whiplash. A regular eye exam rarely identifies the extent that the visual process has been affected, since the visual complications that develop are not related to visual acuity like 20/20, but rather to eye teaming problems or eye focusing problems or tracking across a page. If you're experiencing post-concussion visual symptoms, there's always the risk that they will become worse over time. Some patients notice visual problems only when experiencing additional stress, like illness or family or work stress, or when there's a disruption to their normal routine. A neuro-optometric evaluation can determine both the severity of the impact of the TBI on your visual system and the treatment that's required for your recovery. What treatment can a neuro-optometrist offer? If you've sustained a TBI, we at Family Eye Care in Old Bridge offer neuro-optometric vision rehabilitation. Neuro-optometric rehabilitation, or NOR, is an individualized treatment regimen to rehabilitate the connection between the brain and the eyes and the visual system. This therapy can minimize or even eliminate TBI-related visual symptoms weeks, months, or even years after the injury. If you've had a traumatic brain injury or a concussion, or have the symptoms that we've discussed, call our office, Family Eye Care in Old Bridge, New Jersey. We're happy to answer any questions or to schedule for a neuro-optometric assessment. You can reach us at 732-679-2020. There are many pages that I've written on our website, New Jersey Eyesight, or NJEYESITE.com. We look forward to helping you.